Series Born Today on Monday, we watched miracles, couples across the country welcoming new babies live. But for many others, getting pregnant can be a financial, physical, and emotional challenge. Today, we are focusing on in vitro fertilization, or IVF. NBC's chief medical editor, Dr. Nancy Snyderman, is live from an operating room at St. Luke's Hospital in St. Louis. Nancy, good morning to you.
Good morning, Savannah. I'm here with Dr. Sherman Silber, who's sitting right here to the right of me, and patient in front. And what we're looking at on the screen are ovaries with follicles with eggs in them, and they're being harvested this morning. You know, 40 years ago, there wasn't much of an option for an infertile couple in order to go ahead and have a baby. But boy, has technology changed. So this morning, for the first time on live television, you're not only going to see eggs being retrieved from an ovary, but we're going to show you the fertilization process. But first, I'd like to introduce you to a couple who very graciously allowed us to be part of their experience.
Dr. Sherman Silber is a renowned fertility expert and a pioneer in something commonly known as IVF.
It's short for in vitro fertilization, which simply means fertilization takes place in a laboratory dish.
The pregnancy will implant there.
33-year-old Jessica Menkhausen and her fiancé Derek Mannion are Silber's patients, excited about the possibility of having a baby together.
That's where our babies are going to be.
Jessica had tried for 9 years to have a baby and had almost given up on her dream of motherhood.
It took years to get over it. I was really glad when we met Dr. Silber. He did give us so much hope.
Hi, Jessica.
Jessica has been undergoing IVF pre-treatment for 4 weeks now, injecting hormones and getting regular blood work.
Hopefully these children know one day when we show them this how much we wanted them.
Get thicker.
And today, news that the medicine has worked. Jessica's ovaries have produced a large number of follicles, which house the eggs that will be fertilized with Derek's sperm.
If we count them, that count gives us an indication of how many eggs you're going to have. And it's just a huge count.
The couple have put off wedding plans until next year, citing the cost of IVF, which averages $12,000 to $17,000 per cycle, and it's often not covered by insurance.
We are borrowing to do this.
And they're telling their personal story here, hoping to inspire others.
It's amazing to think what science can do now and how it can help us out in conceiving.
It's an all-or-nothing gamble for Jessica and Derek, who are spending their savings on what, for them, is a once-in-a-lifetime chance at parenthood.
We're terrified of spending this amount of money and then it not working. If it doesn't, we'll be sharing that heartbreak together, but it will be heartbreaking.
They say they can't afford to do it again, but remain hopeful about the outcome.
I want to be positive, and I think that we're going to have twins. And I think that they're going to have red hair and blue eyes, and that's what we have to keep thinking.
Right now, Dr. Silber is inserting a micro needle with a little suction into the ovary, and each of these black sacs you see really houses an egg. Those are being sucked out and then will be examined behind us. Can you feel that when you go in there and you're looking at that egg? You know visually exactly where you are?
No, visually exactly where I am, and I also can feel it in answer to your questions. Like there is a follicle right there. We're going to go right through.
And that white line is the needle.
That white line is the needle. And that opening, that little sac you see, has an egg in it. And they're really nice and big size, so we know we're going to have good, mature eggs in there.
You're already finding a lot of eggs. Is that because she's been on stimulating hormones?
Well, she's been on stimulating hormones, but some women on stimulating hormones do not have that many eggs. It depends. She started out with a lot of eggs. Here, let's go for this
So
one.
this bodes well for her, to have such big follicles and have so many?
Yeah, and see, we're excited. She has very few small follicles, and those are the follicles that cause patients to get sick from IVF. And the way we stimulated her, we have only big follicles. And these big follicles are going to be mature. They'll have.
And this is a safe procedure with these medications for Jessica, right?
It really is safe if done right. If not done right, it could be dangerous.
But you know, I have to underscore, and that's exactly why you go to a center where IVF is not only established, but doctors have been doing it for years and years and years, so that one, you harvest healthy eggs, two, it results in healthy babies, and three, the health repercussions long term for mom minuscule.
Nancy,
so that's it for Savannah. Savannah, we'll be back to you shortly. Hey, Matt.
Can we just ask you real quickly? She is sedated, but will there be
bet.
discomfort from this procedure, you know, in the coming hours or days?
She is sedated, and there will not be discomfort. There is a vaginal probe in her which allows us to see the ovary, but it's no more different than a pelvic procedure. So no, she's going to have minimal discomfort, and they'll watch for a little bleeding afterwards, but they expect no complications. This has been going absolutely perfectly this morning.
I hope that continues. Dr. Nancy Snyderman, thank you so much. We know that in our next half hour she's going to be there. We'll watch the procedure live on television. This is the first time when Jessica's eggs are fertilized. We hope we are rooting for them.
Yeah, I was going to say, after you hear their story, how can you not root for them?
Absolutely.
Be successful in so many other couples around the country as well.
But first, more of our series Born Today. In the last half hour, Dr. Sherman Silber conducted the first part of an IVF procedure retrieving Jessica's eggs in the operating room. And now, hold on to your French fries. We're going to turn to Dr. Nancy Snyderman. She's actually moved into the lab where we're hoping to catch a conception process live. Jessica and Derek are in the recovery room. They're ready to watch. Dr. Nancy, good morning. Fill us in on what's going on.
Hey, you guys, let me orient you because this is one of the coolest things you're ever going to see. This is just a pipette that's holding an egg in place. This is an egg that was taken from Jessica just a few moments ago. This little thing on top is called a polar body, and I'm only telling you that because the egg has to be oriented in space. And what you're going to see Kathy do right now with a needle on this side, which has a sperm in it, is puncture the outer layer of this egg. You're going to see how tough it is. That little sperm is right there. Pop into it. The sperm will be released. And as soon as she knows the end of the needle's there, boom, there went the sperm. The sperm is right there. This is now a fertilized egg. Conception has taken place. And this now will be put into a special medium for the next 48 hours as a fertilized egg and observed. Wow. You have now, for the first time ever on television, seen a sperm go into an egg, and that's modern IVF. That is cool stuff.
Well, Nancy,
and we're going to keep doing more. Now, I know, Matt, you're going to really love this part as Kathy goes ahead. These are sperm that are swimming around in this special solution. What she does is she literally...
Not sure where you're going with this,
Here's
Nancy.
the fun stuff.
Matt really loves
she
to see
whacks
that.
the tail off the sperm.
Now
Did
wait
you hear
a
me,
second.
Dad?
Yeah, no, it's amazing. But now you have a fertilized egg, and then they will implant those fertilized eggs in Jessica. How long will we know, or will it take to know if this is a viable pregnancy?
Well, so we got a lot of eggs out of her today. So again, there's the sperm in the needle. Pop in, the sperm goes back up. Boom, it's in another fertilized egg. 48 hours, this will be watched. These will now start to grow under the microscope. And then Dr. Silber, because he's a very ethical doctor, only implants 2. You've heard of the controversies before where there are too many fertilized eggs put into women. The uterus is not a condominium. You put in 2, hoping for 1 or 2 healthy babies and pregnancies, right?
Yes, and we can freeze the extras safely.
And she can hold on to them for a long, long, long time. And in some cases, even be given to other women.
Absolutely, and they will never be hurt by our freezing process.
Nope. So this is safe for mom, cool for dad, great for science.
Well, Nancy, you really have a way with words. The uterus is not a condominium. I will remember that forever.
This is pretty neat. So we're just going to stand here and again watch this go on and on and on and keep fertilizing these. A lot of sperm, very healthy, and with these eggs being able to be held here by suction, the 26, 27, 28 eggs were harvested.
Wow.
And they'll all be
amazing.
fertilized and then stored. And then the best ones will be implanted in Jessica. And we will follow up with Derek and Jessica over the next couple of days and months. And I have no reason to not expect that this is going to result in a healthy pregnancy.
I'm sure this is going to work.
And I have to tell you, doctor talk earlier, we were also saying she has a really good-looking uterus. So I think this is going to be a go.
And 27 babies.
Well, thanks to everybody.
27 babies. Human eggs aren't that good.
That's so exciting. The first live
you guys,
IVF
but it's all looking
procedure.
good at St. Luke's in St. Louis.
Oh, good.
And
Well
thanks
done,
to
doctor.
the folks out there
Well
for letting
done.
us do that.
Guys, is that the first IVF procedure you've watched with French fries?
Yes, that's
I
amazing.
just acknowledge the
It's like
weirdness
dinner
of
on the
that.
show.
Bizarre. Anyway, we'll keep track of Derek and Jessica, find out what happened.